Hey, this is James, fitness instructor with PSP Kingston, coming at you today with another fitness workshop topic. So today we're going to be talking about an injury prevention fitness workshop topic today. So the injury prevention topic we're going to be talking about is lower back health. So jumping right into it. So in terms of lower back health, what we're talking about here, and to kind of give you a little bit of a broader scope, when we're looking at a healthy back, what does that really mean? So now just kind of actually backtrack a little bit. When we're talking about lower back, we're talking about your lumbar portion. That is a very common area that people end up having ailments or injuries. Sometimes they're major, sometimes they're minor. So it kind of depends on what you have there. Now, the key thing when we are looking at lower back injuries is you do want to make sure that you do get that checked out by a medical professional and make sure that you have the full scope of what's going on there. Just because of the fact that lower back injuries can be very complex, and they also can be very serious depending on what it is. So you definitely want to get a real in-depth medical professional opinion and analysis to make sure that you know what you actually are dealing with before you kind of go down any kind of road. But once you have a little bit more information in that respect, so again, you've talked to the medical professional, they've given you, what they believe the injury is, or a little bit of a better idea, and they have given you clearance to start working on that, and looking at stuff like that. That's kind of where this kind of falls into play. So it's once you have that medical clearance to be able to, start targeting that specific thing. So again, it kind of depends on the seriousness of the injury and how bad it really is. Will kind of depend on your direction. But what we're talking about today is more so on the side of prevention than once you actually have a serious injury. So when we are talking about healthy back, healthy lower back, what do we mean by healthy? So there's kind of two parts to that. So the first part is injury-free, right? So a healthy back would be injury-free, and basically, the main marker of injury would be pain, right? So, usually injury is indicative of pain. So if your back is pain-free, generally, whether it's during activity or not, and all sorts of different parts of your life, that would be kind of that injury-free we're looking for. But to kind of expand on that, it's not enough to just say to be injury or pain-free isn't necessarily the only factor here. You also want to look at having your healthy lower back functional, right? So functionality is the ability to actually use your lower back for tasks. Your lower back is a functional part of your body that is utilized a lot, specifically with lifting and mechanics like that. So to say that it's functional is that it actually has the ability to do tasks that you need it to do. So, you can have an injury-free or pain-free lower back, but the functionality is not that great that it can't actually be used for tasks, or using it for tasks does risk injury or pain, right? So it's kind of the combination of the two things, that you don't have pain or injury, and that you have functionality in it to be able to actually utilize it to its full capability. So that's what we mean when we're talking about a healthy back. So two things we're going to talk about in that, guys, of two things you can kind of look at, work on to kind of aim towards that healthy lower back. We have stretch and strength, right? So our two S's, we have stretch and strength. So we'll start off with the stretch, okay? So the stretch is more in terms of, we're going to look at like three key things, but you're also looking at just your movement, right? So that is kind of the way to gauge. So, obviously looking at, making sure that you have no pain or injury with movement, and then also just making sure that your movement mechanics are good with a bunch of different things. So, but when we are looking at specific stretching, targeting kind of like that health of the lower back portion, we can look at three H's. So you've got hip flexors. So your hip flexors are muscular tissue. There's a bunch of different ones. So we're just looking at the main grouping of tissues that run along the front of the leg that are involved with hip flexion, which is raising the leg up, the thigh up. We've got the hamstring group, which is the muscles that work on the back of the leg, which are involved in knee flexion as well as some hip extension, so moving the hip back. So there's your hamstrings, your second H, and our third H, we're looking at hip musculature. And what that usually does fall into is kind of the glute region. So that's just the musculature that's in the posterior and the back region that is a little bit higher than the hamstring area. And in that posterior area. And again, its primary function is hip movement, mainly extension, so kicking back, and then also a little bit of rotation sometimes. So those are our three H's: hip flexors, hamstrings, and hip musculature in the glute area. So the reason those three are important from the aspect of lower back health is that all three of those muscle tissues have insertion and exertion points. So they basically run along and pass through the spine area and the pelvic hip structures. And that's important to realize that if there is some dysfunction or those areas don't move or need to be lengthened or stretched and be more mobile, is because if they are tight and dysfunctional, they are going to do weird things to the spine and then therefore increase the risk or cause pain. So for instance, your hip flexor musculature running through the front of the leg actually passes back and actually does have attachment points on the spine itself. So it actually attaches on the spinal column. So again, that's important to realize, because as those muscles get tight or dysfunctional, they're going to start to constrict as they tighten, and that is going to move your spine into weird positions or put extra stress on your spine when you are moving. So that's where stretching of hip flexor is very important because of that attachment in the spine. Hip flexor stretching, again, you can look through some of the other intervention videos on the CFMWS page, but primarily looking at lunge positions. So lunging positions where you're stretching out that front portion of the thigh. In that lunge position, we'll stretch out some of that tissue. Our next piece there, hamstring, same rationale. So it attaches around the knee area and then the insertion points. So what you're looking at is it crosses the hip area, and again, it has attachments up in the upper pelvic area. So it crosses through that hip portion, and again, your hip is very indicative of your spinal health as well. So once again, as those hamstrings get tight or dysfunctional, it's going to start pulling the hips in weird directions. So if it's tight in one way, if you have one side that's more tight than the other, you're going to start to shift, moving in weird directions, and that just gets amplified even farther when you do include movement. So hamstring, same thing. You get that cross section of the hip and spinal area where the muscle kind of runs along in your body. So important, same in the hip flexor, but just on the opposite side. Hip flexor on the front, hamstring on the back. So hamstring stretching, most people are pretty familiar with this. It's any kind of straight leg stretching, so your hurdler stretch, putting your foot up on an object like a table or a chair, leg straight, reaching for the toe, is more than sufficient for that purpose. And that would be a good way to stretch out that posterior portion. And then our last H there, the hip or glute muscles. Again, same thing as the hamstrings. They are very intricate muscular tissues that cross the hip area and move around, and they actually do a bunch of different attachments on the pelvic region. And again, as they get tight and dysfunctional, you get weird kind of postural alignments, which are going to move around the spine in terms of ways that it really shouldn't be if they are tight and dysfunctional. So hip glute stretches, a lot of that stuff kind of falls back on yoga area. So if you look through our channel, find some of the yoga stuff, you'll find some great stretches for hips. But most hip stretches have to do with kind of just bending the knee and moving through that glute stretch. The most common one that most people might be familiar with would be a pigeon stretch from yoga. That's going to help to kind of stretch out that hip glute area and get that function back. So stretching is your main thing. You can also do some tissue work, which would be doing some foam rolling of that sort. But that's a little bit of a different talking point there. Doing myofascial release or not, even just stretching enough will help with that tissue quality. So the stretching recommendations for this would just be very general stuff, 2 to 3 sets of 20 to 30 seconds per side, just alternating back and forth, for the left and the right. And the frequency of this, stretching is very important that the frequency is high. So to do this once a week, say, or maybe even just twice a week, really won't pay that great of dividends, especially in the initial stages. Long term, once you do have a little bit more function and mobility in those areas, you don't have to do as much. But in the initial stages, if you do have tightness in those areas or some dysfunction, you want to hit it with high frequency. So that would be 5 to 7 days a week with a bit of a lower intensity, right? So you don't want to do a ton of stretching, just a little bit, and that'll help to kind of like get the tissue to remobilize, stretch out, get a little bit better function and movement in that area, and that'll kind of hold a little better when you do that with the higher frequency. The best way to keep that movement and function long term is to just have good movement patterns. So the main movement patterns you'd be looking at here that you would test out, would be squat mechanics, right? So just doing simple body weight squatting and kind of seeing how your movement is. Can you squat to a good depth without any kind of pain or dysfunction, and having good patterns? Again, lots of great resources on our page for that. And then the other movement pattern that would fall within this would be hip hinging, right? So just bending over through the hip portion. Are you able to achieve a good hinge pattern, again, without pain or dysfunction? And does it actually look good, right? So those would be the two things that would kind of be the markers that would tell you, if this stretching is doing what it needs to do. And those are also really good patterns that once you have that proper movement in these areas and overall in terms of like your lower back health, we just need to continue doing those movements in exercise, right? So continuing squat patterns and hinge patterns, in your exercises will help to keep those tissues moving properly as long as you're doing them, with proper form and range. Is kind of the most important part, and then you can kind of start to move away from that direct stretching of those tissues once you already have that functional movement in those patterns. So that's just kind of another way to stay healthy with that and to keep that movement. You don't really have to do that much in terms of like specific stretching, as long as your movement patterns stay good. As soon as they start to break down for whatever reason, the big thing where you end up with breakdown with that is a lack of movement, right? So not doing movement that often, as well as from a job or an environmental perspective, if you do spend a lot of time sitting, that will result in tightening of those muscle tissues, right? So that's just that movement factor will help with that as well. So that's our stretch portion. Again, you got those three things: hip flexors, hamstrings, and hips and glutes. Stretching out those tissues to kind of get those tissues healthy, mobile, and functional. So that's kind of the initial stage, and that's your stretch portion. But again, as we talked about before, healthy back, there's the injury pain-free portion, and that's more where the stretching portion kind of comes in, where the stretching will help with that. But if we're looking at functionality and actually being able to use your lower back for its purpose, then you're moving into this other S here, where we're moving into the strength portion, right? So, once you have that mobility, you can do both at the same time. It's not to say you have to get the one and then the other. It is beneficial to get the stretch portion kind of more before the strength portion if you do really have some serious limitations or dysfunction. But you can hit both, but when you're looking at functionality, we are looking more on the strength side than the stretch side. So when we're talking about strength of the lower back or the back, what you're looking at there is a common term you might hear would be midline. So your midline is all of your torso musculature. So basically anything, kind of like rib cage down and then kind of above your hip area. Right in there, that is what we're talking about when we're talking about midline. So your midline is important for some of those movement mechanics we talked about before when you're talking about squat patterning and hinge patterning. Your midline is the thing that keeps your body in the proper alignment when you are doing that stuff. And then also just regular day-to-day activities. So when you are going to pick up a heavy object, a box or whatever it might be, your kid, your midline is the thing that's going to stabilize your torso and keep it in the proper posture alignment that you want for doing said activity. So that's where it's important there. Now, when we talk about midline, there's kind of two pieces to talk about when we're talking about midline. We have our core and our lumbar portion. So we'll start with core. Core is the most common one that people kind of do associate with midline work, and it is very important. The core is a full wraparound, but it is kind of more primarily when you're looking at it from the anterior portion, so the front of the torso, the midline when we're looking at that. And so we're talking about core. There is a whole breadth of different provisions and things when we're talking about core. Anti-flexion, anti-extension, resisting rotation, all these different things, because the core is very dynamic in terms of what it does. And again, there's lots of information on the CFMWS YouTube page, as well as some of the other PSP resources where you can kind of find some information on core training and how to kind of work that in. A little bit outside of the scope of what we're talking about here, but in general, core training, most people are pretty familiar with that. So, you're looking at planks or other variations of planks, right? So that is your anti-extension exercise right there. So resisting that extension with that core musculature. And then with planks, the variation and the advancement is usually adding in movement, which then adds in other components of anti-rotation as well. Another great exercise that I like to speak on would be the Palloff press. The Palloff press is a little bit of anti-rotation as well as anti-flexion. So it's another great exercise that kind of primes your core with some resistance and movement. So if you're not familiar with the Palloff press, have a look up on YouTube of that one, or in the core exercise descriptions on CFMWS, but another great exercise there. So again, core is a very common prescription for lower back health and for midline health and midline strengthening, and it is a very important factor. Now, the one thing with core, again, same as we talked about stretching, you do usually benefit a little bit more from core training from a frequency perspective than you do from an intensity perspective, right? So you are better off to add core in at a high frequency rate of 5 to 7 days per week with just a little bit here and there, vice doing a single day of like a lot of core training. Core training is more about kind of like a mind-muscle connection and figuring out how your body moves and kind of priming those things rather than really targeting musculature per se and trying to create a big deficit from the perspective like hypertrophy or anything, right? It's more about getting movements and being able to stabilize. So core training, again, kind of benefits a little bit more from a high frequency model, hitting it 5 to 7 days per week at all your training sessions, just a little bit, a couple sets here and there, vice doing a whole 1 hour day where you kind of target things. So that's just kind of a perspective of core training that you get a little bit more benefit from. And same with the stretching as well. With core training, you also do get some of that from doing exercises. So you will get some of that core strengthening once you have those mechanics, and they do move really well. You'll get that. You get that a little better basically if you do it within your exercises, right? So if you are doing squats and heavy deadlifts and stuff like that, you are going to be getting that core training. So sometimes it is good in the initial stage if you're not familiar with those exercises or you are having some issues with dysfunction in them to do them very targeted. But once again, you have that, you need a little bit less, and then you can get some of that benefit from just doing other exercises which involve the core, such as heavy lifting exercises like squats and deadlifts, as long as you are keeping your midline stable when you are doing them. So that's the one side of midline that most people are familiar with is core training. But the other side of midline training that sometimes often gets a little bit forgotten or overlooked or just kind of not thought of as much as lumbar. So your lumbar tissue is your lower back musculature. So it's the muscles that run up the spine. The technical term for those is erector spinae. And basically the meaning of those is basically to keep your spine erect, right? So that is to keep your spine in a straight position. Their job is to run along that spinal portion, especially in the lower back portion of your spine, the lower portion, to keep it from going into a flexion position or overly extended. It keeps it in that straight posture that it works best in, right? So that is the primary purpose of those muscles is mainly the isometric contraction that keeps the spine in alignment. That's important because the spine is meant to stay in a certain position. When it gets out of that position, especially when there is load, that is when injury happens. So some of the ligament structures that run the spinal column, as well as your intervertebral discs. That's when you end up with a disc bulge or herniated disc. And again, that creates a whole other host of injuries as a result. So that is where the lumbar muscles, the lower back muscles really do come into play. It's keeping that spine in alignment. So again, there is specific training in the same way of core for those lumbar tissues. So the one big one that you would look at would be deadlift variations. Now, just a quick little plug here. If you are looking for a little bit more information on deadlift variations, deadlift knowledge and whatnot, the PSP Edmonton Instagram page is actually running a virtual deadlift seminar right now. So they've got a little Q&A on their website, so you can throw them a question if you have any questions, and then they're going to run through some different variations and how to do that exercise. So if you're looking for a little bit more info on deadlift and the variations, check that out with the PSP Edmonton page. Now, just speaking on deadlift variations though, basically deadlifting is just picking up a weighted object off the floor, coming to an erect position. So the key thing there is keeping your midline engaged, your lower lumbar engaged to keep your spine straight will be the way to train that. But the key thing with deadlift variations in terms of training and in terms of lumbar is that you're using a controlled movement mechanic. So there are different applications of the deadlift, when you're talking about sport specificity like powerlifting and stuff like that, where that control portion is not quite as applicable in a competitive stance. But if you're looking at it more from the training stance and you really are looking at targeting your midline lumbar portions, that's where you want to have controlled concentric, and then specifically a controlled eccentric portion, right? So the lowering phase of the bar, you want it to be controlled, slow. So this is where you would do, touch and go deadlifting with some tempo to it. So like 2 up, 2 down. Or you would also use some deadlift variations. So one of the most common variations, Romanian deadlift or a straight leg deadlift, where you use a little bit less knee flexion, a little bit more through the hip, a little bit more of a hinge pattern to target some of that posterior region like your hamstrings and glutes, as well as you're going to be keeping your lumbar in a very tight position because of that slowed down eccentric and concentric portion. So that's another option as well when you're talking about deadlift variations, would be looking at that very specific Romanian or straight leg deadlift variation. So that's a big one there, but a couple other options to talk on. Another exercise that is a little bit more targeted even than deadlift, because deadlifting does involve a lot more musculature. You have your grip portion in terms of holding the bar. You have your upper back portion as well in terms of keeping good posture overall. So there's a lot more involved there. Something a little bit more targeted would be like back extension exercises. So there's a couple different versions of that. You can do a 90-degree back extension exercise on specific back extension or GHD, glute ham raise machines. And then even past that, the more common one and probably a little bit more indicative and easier for people to do would be a 45-degree back extension. Again, a very common piece of equipment at most facilities. We're at a 45-degree angle as opposed to that straight 90, so that little bit of an angle creates a little bit more tension through the lumbar portion throughout the entire range of the motion. So doing those exercises are good, but again, they are good too because you take out some of those other factors of deadlifting, like your grip strength and your upper back strength in terms of holding those mechanics. You're really just kind of targeting that posterior region and working those lumbar tissues a little bit more directly. And it also allows you to do, different, rep ranges and stuff like that you might not be able to achieve as easily with deadlift variations. You go to really high reps, you can do pausing, stuff like that. So they have that benefit that the deadlift variations might not. So that's another option there. And just another option to throw in there, kettlebell swinging or any kind of swing variation, or doing pull throughs on a cable machine. Those are also options as well, which work, that hinge mechanics. And that's going to help you, again, with the hinge mechanics. You're looking at isometric contraction of the lower back muscles in that sense to kind of keep that spine in alignment as you go through, right? So again, all of these things are on the contention that you are using proper body alignment when you are doing them will give you the most benefit in terms of training that lower back musculature. So again, the kettlebell swing is another option. The reason I put it at the bottom is kettlebell swings are very often prescribed, but they are a very advanced exercise because of the dynamic nature of the swing portion as well as the catch portion at the bottom. So it's a dynamic exercise, so it's kind of the bottom of the tier, just in the sense that you do kind of have to work towards that. And because of the dynamic nature, it's a little bit harder to sometimes really kind of target the muscle tissue that you're really looking at. So it's an option, but again, more an advanced option. So. But again, the key thing with the lumbar portion that is a little bit different than the core portion as well is vice the core, which is not as much on the hypertrophy perspective. There is some hypertrophy perspective when you are talking about lumbar tissue because the musculature is a little bit more direct in terms of the way that it sits on the body and the way that it interacts, and because it is so important from that isometric contraction perspective. building up that muscle is an important factor. So the other thing too with lumbar tissue is that because it's a bigger muscle tissue and the way that it operates, it's a little bit less on that frequency model that we talked about before. So core training, something you can kind of dabble in, throw in a little bit here and there. Something where you are looking at lumbar training is something where you want to take that frequency down and give your body a little bit of rest so that you have time for recovery of those muscle tissues. But so a little bit different there in terms of that perspective. But again, just to kind of summarize that strength piece, right? So when we're looking at strength, we're looking at our midline, our torso area. So again, broken down into two sections. You have your kind of more your anterior portion where you're looking at your core musculature, and then you're looking at your lumbar lower back musculature on the back. So again, core. Most people are pretty familiar with core exercises, high frequency model on that one, hit that nice and frequent. And your lumbar tissues, a little bit less frequency, and looking at that isometric contraction of the lower back muscles. And just another talking point on the lumbar. There's kind of two perspectives there in terms of failure of your lower back tissues when you are doing movement mechanics and this midline strengthening portion. The 2 points are either maximal load, right? So the muscle tissue is just not strong enough to hold the load, which is not as much of a concern. The more concern is the endurance perspective. So doing repetitive things, so repetitively picking things up. So for instance, picking up a heavy object like a sandbag repetitively, the lower back musculature has the high capacity to be able to hold that position, but it doesn't have the endurance capacity, and it starts to break down over time. So that's an important factor in terms of your lumbar portion and the isometric contraction is not only the maximal strength output, but also having an endurance aspect and being able to do it repetitively without fatiguing. So just another kind of consideration there, not only heavy, but also like high reps and endurance perspective as well. So again, just our quick summary on our lower back health portion here, right? Healthy back, you want to be injury and pain free, and you also want to have functionality in that musculature and in that area to be able to actually use it for day-to-day tasks. So again, stretch and strength, right? So our stretch portion, focus on those 3 H's, hip flexor, hamstring, and hips or glutes. Try and bring that, your movement patterns, your squats, your hinges, get them better, get your postural alignment in the proper positions through some of that stretching of those key areas. And then our next portion there, moving to that functionality side, we're looking at strengthening your midline, strengthening your core, strengthening your lumbar lower back muscles. Combining all those components is really going to pay some really high dividends in terms of the health of your lower back, staying pain-free and being able to use that lower back for a long time. So, again, lots of topics here that there are some additional information. So I already talked about PSP Edmonton, but again, if you subscribe to the CFMWS YouTube channel, you're going to find information on a whole bunch of other topics here that we already talked about, some of the core stuff, some of the stretch stuff. You're going to find some of our yoga videos or our mobility videos. So lots of different things you can pull out of there that would apply in this one here. But, the key thing that I'm hoping that everyone took from today's little fitness workshop is just some little things you can kind of add to your training to help with your lower back health and trying to stay injury and pain free for a long time. So again, if you're looking for a little bit more info or you have questions or anything, subscribe and comment on the CFMWS YouTube page, as well as the PSP Kingston Instagram, Facebook, and YouTube page as well. Give us a follow on those and subscribe. And if you have any questions or comments, you can let us know. Happy training. Have a great day.
PSP Kingston, the health and wellness provider for the military community.